So this little fox came in to another rehabber from Suffolk. It was brought in because it appears to have a problem with its eye. This eye is definitely cloudy and has some kind of issue. Just going to have to see the vet for this. For now, about the only thing I can do is put some lubricant in there to help maybe with the irritation, so he can get some tests done to see if this is actually a cornea issue or if it's something else. The other eye looks pretty good, and he can definitely see. He's been without his mom for a little while. He's skinny. He's also got some ticks on her. Normally in the wild you won't see ticks on babies because their parents are grooming them. Fox stay in family groups of mom and dad and the babies. So I'm not sure exactly what the backstory is on this guy, but I am going to get it from the animal control officer that brought it to the other rehabilitator. So I'm just basically doing a physical exam on him.
So this is your first time seeing this fox?
Correct. He just came in about an hour ago. I let him have some time so he could decompress before I start handling him, just to make sure that the stress doesn't, send him over the edge. These are rabies vector species as well as things like the mink and the otter and beaver and raccoons. He actually has a wound on his left front foot as well. I'm not exactly sure what that is. Could be a bite wound. It's kind of hard to say. And since he's in the condition that he's in, he will not go in with the other red fox that I currently have, that I've had for a little while, because we want to make sure it is a bite wound, because there's the other part. We want to make sure that he is not going to give them anything. So everybody gets separated and then quarantined basically when they come in. He's also got seeds in his fur.
Like tree seeds?
Like plant seeds, grass seeds, that kind of thing. His body score is pretty low. Typically with the mammals, I do a body score of 1 to 5. 3 being good, 5 being fat, and 1 being emaciated. I would say he's probably about a 2. I can feel his spine and his pelvis and his ribs, so he's pretty thin. So he's probably been away from his family for a little while. His coat is pretty normal for his age. They're woolly before they start getting in their adult fur.
How old would you estimate him to be?
This guy is, I can pretty much tell you exactly how old he is if you'll let me look at his teeth without trying to bite me. Hey, buddy. Let's see. So you obviously don't want to stick your fingers in his mouth, but I can do this and see that he's got the majority of his teeth is baby teeth. He's just now getting the last of his premolars and his molars in. So I would say that he's probably about 4 months old. Also his gum color, we look at that. I do exams exactly like I would on a dog or a cat. His gum color is a little pale, which is not abnormal for somebody who's not been eating very well and has ticks. But the big thing is getting his eyes checked out. Nutrition, good nutrition is going to help correct his thinness, and we'll get him in front of the vet so that we can get these bite wounds checked out and get those eyes checked out for him.
So when your animals have to go to the vet, do you have to pay for those vets? Because I know that can be pretty costly with our household pets.
I am extremely lucky that the vet that I work with does not charge for exams. I do have to pay for medications, but the exams, she's really great about not charging for exams. Sometimes testing and that kind of thing needs to get paid for, but so far it's not as high as taking your family pet to the vet.
But you have a lot more animals than most of us have at home.
Exactly, yeah. So it would add up to a lot.
And just as a reminder, wildlife rehabbers all work off of donations and their own money. Most of them work other jobs as well. This is something that they're volunteering their time for, and that's why we are trying to fundraise and get some extra money to help out, to help feed these animals, to help with their care, their medical care, and then also eventually our goal is always their release when possible. It does not look like a happy fox.
He's not terribly happy. He does have some nystagmus going on.
Some nice what?
Nystagmus. Nystagmus, I'm going to put him up. Nystagmus is basically where the eyes go like that.
Okay.
It's usually indicative of head trauma. Sometimes, but not always.